All right, well, welcome everyone. I'm delighted that you could join us. This is always the highlight of my day when we can do one of these over lunch. So today we're going to have Dr. Dafna Rand, who is with the US State Department and USAID. She's in the Office of Foreign Assistance. She's going to talk to us today about US foreign assistance and global health. And I know we're keeping some time at the end for some questions. And I know at least I have a few questions, and I know many of you do as well. So let me just introduce her. So she is currently Director of the Office of Foreign Assistance at the Department of State. And she has a long career there. From 2017 to 2021, she was Vice President of Policy and Research at Mercy Corps, which is a non-governmental organization working in 40 countries to support communities in need. She has a long history in public service. She served as Deputy Assistant Secretary in the Bureau of Democracy, Human Rights, and Labor, and as a member of the policy planning staff at the State Department. She also served on the staff of the National Security Council during the Obama administration. Dr. Rand is the former Deputy Director of Studies at the Center for a New American Security, CNAS, and a former professional staff member of the U.S. Senate Select Committee on Intelligence. She started her career in government as the Foreign Policy and Defense Legislative Assistant to Senator Frank Lautenberg. So thank you for joining us today, Dr. Rand. I mean, it's exciting to have students be able to hear of not only a longtime State Department official, but somebody who's been in the field and has a really good pulse for foreign aid and global health. So two top topics for us today. So thank you for joining us.
Great. I am so happy to be here. I know we are working to get some slides up, so maybe I'll introduce myself and our team and who I am as we wait. So I'm Dafna Rand. Thank you for the kind introduction, and thank you to the students and faculty at UT for joining us. One of my goals since assuming the helm of F, is what we call it, Foreign Assistance at the State Department, is to really get out and talk to folks all over the country about the role of foreign assistance in our foreign policy, and to educate folks, but answer questions and really engage in a dialogue with folks all over the country. So you are the first in what I'm calling a virtual road tour, which Zoom makes all the easier, of course, because there's no need to fly anywhere. And so I'm just really honored to be with all of you, and hope that someday I can visit you and your awesome university. So I am the director, as mentioned, of the Office of Foreign Assistance. It is a State Department bureau that is comprised of both USAID and State Department employees. And our mission is to coordinate the $40 billion or so of US foreign assistance that are given each year around the world for a variety of purposes and objectives. Now, people might be surprised about that number. Some of you may have thought that we give more in foreign aid. Some of you might have thought we give less. So to put that $40 billion in context, the United States is the largest donor of humanitarian and development foreign assistance in the world. So 40 billion represents the most objectively of any one donor. The second biggest donor is the United Kingdom. And the other fact I'd mention about the $40 billion figure is that it has been relatively stable over the past 5 or 10 years, around 8 years. That number has grown steadily since 9/11, as people can imagine. We can talk about why, but it has been relatively consistent over time. So in a second, I'll get to the slides. But first, I just wanted to say that one of our goals here in AF is to work on behalf of the Secretary of State, who has the authority to manage this money on behalf of Congress, to use the funds strategically and to reflect whatever is going on in the world, where the needs are, what the national security priorities are of any particular president, in this case, President Biden and Harris, and to respond to what's going on. So we're going to start with a slideshow, and then we're going to go into the global health portfolio. I should first say that I'm honored to be joined by members of our team at USAID, colleagues who are working on the COVID-19 task force, and they're here to answer questions and speak. And we have Liz Leibowitz, I see her, and a few other colleagues, I believe. And what's great about it is that, we are here in F coordinating these $40 billion, but we're not the expert in every single portfolio. We can't be the expert in both economic development and health and climate and democracy funding and all the different sectors at once. So we really rely on our experts. And
hi, Dr. Holmes. Hi, could you please open the slides? They were just sent to you, if you don't mind.
Sure.
They were just sent to you. They might be in your junk, but yeah, they're great slides.
Okay, so we'll start with the slideshow, but I wanted to make sure that to let folks know that we have as special guests other colleagues from state and USAID who are working on the global health programs. All right, so let's start with the slideshow.
Okay, I need Shabnam, you need to
Yes.
enable.
I think it should be.
Oh, now you do. Now we got it. Okay, here we go. And then I will make sure we do this because I have some questions, but let's get here as get going. All right, here we go.
Okay, as I mentioned, there are two parts of this presentation. The first, just to give a bit of an overview of foreign assistance, and then to dive deep into the sector, the global health sector, because I believe that's the course at hand. And then for you to really ask whatever questions you want, please feel free to ask us and pepper us with questions. We want to be helpful. So first, a bit about what is foreign assistance. We can go to the next slide. The mission statement in the US law that codified this in 1961, and this was a John F. Kennedy administration law, the US Foreign Assistance Act, describes the mission of US foreign assistance this way. And this is the mission statement of our office. And you'll notice here that foreign assistance is not just to serve development purposes, but also to advance US national security. And that you could have asked a question of why that is so, and we're happy to talk about it. But the idea here is that the resources at the State Department and USAID are very carefully tied to US foreign policy objectives at any given time. And we can't pretend otherwise, right? There's altruism behind this, but there's also a realpolitik, to put it sort of very bluntly. Okay, next slide. Okay, so here we're trying to give you a little bit of the breakdown across the different pots of money. You might, the wording is a little small here, but roughly across the $40 billion, we divide it into a pot of money that is growing, as you see, to around $10 billion in economic development. And that would include our climate adaptation programs, our climate funding, but also pure economic growth programs, helping folks get jobs, helping folks train to get jobs, jumpstarting market-based economies, and a whole host of programs all over the world. Now you'll see the other $10 billion chunk is in the health program and within the health programs, and that includes a wide variety of activities that range from trying to end the malaria. The problems with malaria is the largest killer of health killer of children in Africa. Tuberculosis programs, AIDS programs, of course now COVID efforts, including vaccine distribution, as well as all kinds of health programs that work on primary care issues like vaccinations and primary care for prenatal care for pregnant mothers, child and mother maternal health outcome issues. We know that around the world in developing countries that there are many countries where children do not live on relative or on aggregate to live to 5 years of age at the same rate as in the developing world. And we'll get back to that. A good chunk of the money, around $9 billion, is in the security sector. And I think folks are sort of surprised about that. They think DOD might have all this money, but actually before 9/11, all of the security sector foreign assistance was right here at the State Department. And now, 20 years later, it's basically divided, where Congress has given DOD, the Department of Defense, around $9 billion and the State Department around $9 billion. And then the last percentage is humanitarian assistance. And this is the emergency fund. So if there's an earthquake, if there's another natural disaster, if there's a civil war, if there's immediate fleeing of migrants across borders or internally displaced folks within borders, this is the pot of funds that we use for those emergencies. And we allocate and budget it globally, because you never know from one year to the next where we're going to need to use it. Maybe, for the past 10 years, we've obviously used a lot of this in Syria, in Yemen, in South Sudan, in northeastern Nigeria. But then this year, we've had to use a lot of this in Ethiopia because of what's going on there and elsewhere. And then finally, a small percentage of this budget of the $40 billion pays the expenses of the workers at USAID who are paid for by foreign assistance dollars. Okay, so hopefully that gives you a little bit of the breakdown and clarifies the different buckets of what we're spending the money on. We can go to the next. So I just went through these major types with the caveat that within these 4 buckets, we have huge, vast types of programs, right? So let's pick humanitarian aid for a second. These programs range from giving food and water to helping in refugee camps, to providing sanitation services, to protecting women and girls who are displaced, because often we have a protection problem. Humanitarian aid programs also go to rudimentary agricultural programs sometimes. So if folks are displaced, or if folks are refugees, or there's a situation of civil conflict, sometimes we use these funding for sort of basic livelihood activities. And then we would move over to the economic and development assistance, more in a situation where there's a stable state and there's a government in play. And that's the real difference. Within economic and development assistance, we have all kinds of programs. We have a huge emphasis on agricultural sustainability. So for years, USAID has really differentiated itself in the world as very good at training farmers to have more sustainable agriculture, to provide food security when there's famines in places like the Horn of Africa and elsewhere. And we're increasingly in the economic development assistance group, we also have a lot of programs that help economies grow in a way that's connected to IT, because this is an issue in some of the developing world where there's not the same connectivity, and that is a prohibition for global firms and multinational corporations doing business in their country. So we have some technical capacity building programs in that part of our assistance portfolio as well. Okay, we can go to the next slide. All right, let's deep dive on that $10 billion portion. And I don't know if that surprises you or doesn't surprise you that approximately a fourth of our foreign assistance budget is being spent on global health purposes. As I said, across the world, different things. A lot of that money, I should say, we can go to the next slide. Before we get into examples of what we've done for COVID-19, I should just say that one rough way to divide the $10 billion is between multilateral and bilateral money. So when we say multilateral funding, we can think of the World Health Organization, the Global Fund, which people have probably heard of. Even before COVID, the World Health Organization, there are many, obviously, UN and multilateral organizations that work all across the world on global health security and global health issues. And even before COVID, we have divided our funding both between the multilateral, and bilateral is a fancy name for money going directly to one country, right? So you can think about it that way. Now let's look a little bit about how we've spent some of our COVID-19 funds. And I should say that Congress, in addition to our $10 billion annual, because of the emergency that COVID posed around a year ago, had an emergency supplemental fund called the American Rescue Plan. And part of that funding gave the State Department an F and USAID and other agencies an additional influx of money, and we've spent it in many ways. You'll see the $4 billion is a multilateral funding. Gavi was an organization, and maybe Liz can talk about it a little bit more, that was set up before this COVID crisis, but has been really instrumental to distribute vaccines. But you'll see that a good chunk of our money on COVID has been spent on the multilateral side. A good chunk of our money is spent on supplies. So people probably followed in the spring and the summer when there was hotspots in places like India, in Brazil, and in other partners of the United States. And we have, through USAID and also our CDC implementers, been able to get supplies and assistance really, really quickly to these hotspots, everything ranging from oxygen to PPE to other more direct and urgent needs. We have tried to spend a lot of money on urgent vaccine delivery. This poses kind of an ethical question because the whole world needs more vaccines right now. And so it's been really hard to choose where to send them and how to stimulate pharmaceuticals all around the world to provide lower cost vaccines than the available options right now, because that's the more sustainable solution, obviously. And then a good chunk of the funding for COVID has been to help strengthen the global health system so that the sort of local ministries of health and their community outreach so that they can survive this pandemic. So think about our own cities in America that have been overrun because of COVID, with nursing shortages and hospital shortages. In the developing world, this has been true, exponentially true. So we've had to help basic primary care, basic hospitals, and critical health activities, even just vaccination campaigns for children that are overwhelmed because of COVID, because it's just hard to get people to do their vaccinations. The nurses who might have otherwise been working on a vaccination campaign were pulled to work on COVID. So a lot of our funding for COVID-19 has been very based on need and the effects of COVID on local health systems. So that's a point I would underscore. Okay, the next slide. As part of our $10 billion annually, we've had one of the most successful foreign assistance programs in American history, which is we have really successfully tried to counter and end the AIDS epidemic through PEPFAR. We haven't fully ended the AIDS epidemic. AIDS still exists, but it's been gotten under control 20 years ago when PEPFAR was established by President George Bush, and he will say, the former president, it was one of his most successful legacy contributions to U.S. foreign policy. AIDS was rampant. It started obviously around the world, but in Africa, it was killing significantly. And it was really, there was a risk that it would destabilize all of Africa, but then other parts of the world. And PEPFAR, I think we can say through our data and evidence, has been a significant variable in staunching the AIDS epidemic in Africa, but elsewhere, Southeast Asia, the Americas, the Caribbean. And you see some of the stats from PEPFAR. In PEPFAR, we keep very, very good statistics here at the State Department. So we're very keen on measuring our impact. And through PEPFAR, we've done many other things. So we've not just dealt with the AIDS epidemic, but we've trained new healthcare workers in primary care outreach. How do you go out to communities and provide information about an epidemic like AIDS and now a pandemic? And a lot of the things we've done through PEPFAR are very relevant and translate well to how we've needed to work during the COVID pandemic. And the medicine itself, I should mention, the retroviral treatments for all these millions of people PEPFAR has paid for, and that has been key to the survival rates with AIDS across Africa and elsewhere. Okay, next slide. And tuberculosis and malaria, we have a U.S. government global TB strategy and a presidential malaria initiative. Both programs have strong congressional backing with many members of Congress, both Republicans and Democrats. This is something that folks agree on across the aisle. There's real bipartisanship behind almost all of the public health work. But on tuberculosis and on malaria, there's very strict congressional laws about how much money and what we do with the money and having a strategy and sending to Congress a strategy. And we've really been a major player in the world's a malaria initiative. I'll give one anecdote of malaria that is really heartwarming because it shows that our foreign assistance really should be a force multiplier. It's leveraging change elsewhere. One of the programs that the Presidential Malaria Initiative funded was a joint research program between an African university, National Institutes of Health, NIH, and a private sector company to do research on a medicine to treat children who had malaria, because even though we have malaria preventative medications, the problem has been that there haven't been medicines. And my understanding, I'm not a doctor, is that this has eluded a lot of epidemiologists and public health doctors. And through this investment in the R&D and the research, just this year, you might have read about this in the newspaper, researchers came out with, or a pharmaceutical company came out with the very first treatment protocol for children and adults with malaria, but it really does strike children in a very deathly way. And so we're very optimistic now, because now our Presidential Malaria Initiative program will not just prevent malaria, but actually has a tool when children fall ill with malaria. So we're optimistic here that our PMI programs actually could eradicate malaria in the next 5 to 10 years with this new drug. Maybe that's a little aspirational, but we're excited that this is an example of U.S. foreign assistance that leveraged change in the private sector. Okay, next slide. All right, so that's it. There we go. So that's just really top lines on how the foreign assistance is divided, and then deep diving into what the $10 billion in global health assistance works on. And then we're going to open it up to Q&A. And I just want, any of my colleagues from the U.S. government who are here just to maybe introduce themselves so you all know who's here from state and USAID. I kind of haphazardly invited people at the last minute, but we have some big brains, including Liz, who I mentioned here. Here's Liz. Okay, that's the big brain. Sorry to put you on the spot, Liz, but do you want to introduce yourself?
Yeah, sure. No, happy to very quickly. And I'll let my colleagues, Janet and Kelly, also jump in after me. No, just happy to be here. My name's Liz again, and I work on USAID's COVID-19 task force. And so we play a variety of roles in helping to organize the agency's response. My role specifically focuses on our external engagement. So everything from Congress, to the NGO and implementing community, to our interagency partners, like State Department. So have a variety of hats, but really get to work with the brilliant colleagues in our Global Health Bureau who are here today. And I actually come from several years working on Capitol Hill, both in the Senate and the House, including on global health issues and foreign policy generally. So I'll hand that over to then Janet to introduce herself.
Hi, everyone. Thanks for having us. I'm Janet Erlofsa. I'm with USAID, the Global Health Bureau. I specifically work in the Office of Health Systems. I've actually been with AID for about 14 years. It keeps growing. I always have to think about how long it's been. So I've been with health systems. With my time at USAID has always been in the Global Health Bureau. I worked sort of program and budget. I've worked on the tuberculosis team. I've worked on Ebola and now in health systems. So I'm happy to join you today. Also mention I'm a UT alum, UT Austin, but you know.
You're in the family.
I'm in the family, yes. I'll pass it on to Kelly.
Hi, everyone. I'm Kelly Saldana. I'm the director of the Office of Health Systems. I also support the Global Health Bureau's technical working group for COVID-19, which works closely with the task force that Liz works on. I've been at USAID for about 18 years, been in the Office of Health Systems for the last 5. And before that was in a office that no longer exists because it got too big and they broke it up, but it included everything that we do in global health except for HIV, AIDS, and family planning. So, and I was the deputy director of that office.
Very good. Well, thank you. Well, I got to tell you, I've had a lot of great meetings with USAID in Colombia and Peru and in my field work throughout my career. So it's really special to have you guys here. And I think I'm going to start off with one question I get a lot from students, which is they want to, maybe they aspire to be a State Department, maybe an officer, or maybe some other role, or maybe they want to work for USAID. And so maybe we start with that. Just, do you have any insights for people who want to pursue a career in USAID or state generally? Where should they start?
So I would defer to our many colleagues from USAID, especially those who've been here as career, because I do think that we would all have different answers, but maybe I'll defer to my USAID colleagues to answer that.
All right, I guess I'll start. So there's lots of different paths into USAID. I think that a lot of people start with a Peace Corps background. Others work for implementing partners. Others come into aid at the sort of program assistant, program analyst level. There's also foreign service officers. There's career staff at USAID. We also have a lot of the staff who work, especially in the Global Health Bureau, are not actually what we call direct hires of USAID. They actually work for contract organizations, and there's a whole host of different partners who are basically sort of workforce contracts for USAID. And actually somebody I saw recently put together a list of those, which I can try to find.
That'd be great. I know, we have a Peace Corps prep program here on campus, and it's a lot of fun. We put that together, and it's not just for our students, of course. I think EP students take more advantage of it, but it's a great way to get some international exposure, even if you aren't traveling yet. And we are getting ready to start sending students abroad again. I'm delighted. So that's helpful. So start with USAID, maybe Peace Corps, of course, and other entrees. That's helpful. So let me ask this question. How does the State Department set their health policy efforts? I mean, how do they set their goals? Specifically, I was thinking, you have this Gavi initiative. What do you think is next? I mean, we all know the challenges of COVID. What vaccines are you working on developing beyond COVID? And how do you set those priorities?
This is a good one. And I'm curious what our folks on the task force think and our folks in our Global Health Bureau think. there's a couple things, right? So one thing from a State Department perspective is we are having a lot of diplomatic meetings with the secretary, his counterpart, with the administrator and her counterpart, with the president and his counterparts. And the world is really coming together at this moment after COVID-19 to think about prevention in a new way. And by prevention, I mean, the rates of pandemics are increasing, and we know that, but really how to share information and how to be better prepared next time, I think, is the source of the conversation. And how to prepare the global health architecture and then the systems in local countries so that they can weather storms like this in the future. So that's the discussion at the strategic level, diplomatically. And recognizing that COVID-19 has set back every country in the world on economic issues, on security issues, on stability issues, on democracy issues. So I think there's been large recognition here at State, in the White House, at USAID, that these issues are interlinked. So we absolutely need to think about global health as a security issue and not just a humanitarian or development issue, because these diseases really do undercut the stability of the communities all over the world, including our own. Over to you, USAID, if you want to talk a little bit about the future of Gavi and maybe even the future of multilateral mechanisms.
Sure, I will defer to Kelly and Janet on the broader scope, but on COVID-19 exclusively would just focus on also thinking broadly about, the realities on the ground, of course, have just impacted how we view and plan for our response. And so to the point Dafna made earlier in regards to the funding that we received for the global COVID response back in the spring, in terms of what we had planned then to do and saw what we would be doing going forward, we really have had to be reactive to the changing global landscape. So that includes, the Delta variant and other variants of concern, these large outbreaks that we've seen in many parts of the world, and also constraints on the vaccine supply. And so that is why, the US government has really stepped up and been the lead donor for these vaccines through COVAX and bilaterally. But I would also put a plug in just generally, as we're looking towards going forward, I think we think about vaccines and getting vaccines into countries, but then there's a whole additional step, and Kelly and Janet can really be the experts here, but in terms of getting those vaccines into arms, into bodies, and ensuring health systems are prepared both from a workforce standpoint and from other logistical standpoints to actually be able to ensure we're vaccinating who needs to be vaccinated and when. And so there's so many components to this that, again, we'll have to change in terms of our planning, but just working with our multilateral and bilateral partners to ensure this is effective is on a scope that's not been seen before. So yeah, over to Kelly and Janet.
Yeah, I mean, I don't have a ton to add. I will just say that I think the COVAX work is, for the vaccine piece, is a arm of what's called the Act A work, which is accelerating or access to COVID-19 tools accelerator is what the acronym stands for. But it really is a collaboration across multilateral organizations to work on COVID. So Gavi leads on the vaccine arm. There's a therapeutics and a diagnostics arm, and arm that's trying to figure out the health systems bottlenecks. So the Global Fund, for example, is very involved through that. The Global Fund opened up a specific window for COVID-19. So for the first time, really expanding beyond HIV, TB, and malaria. And so Global Fund's been issuing grants related specifically to COVID-19. And then the World Bank has obviously got significant funding as well. And then there's some other smaller organizations in the multilateral space and big ones, the regular WHO and UNICEF that we work with. But I think Liz touched on something important that we think is critically important to work with multilateral partners, but we also think that USAID brings important bilateral relationship to that. And so it's really the ability to marry global level work with multilateral partners with our presence on the ground to know what's happening in countries and with field staff to really get things done sort of through that bi-directional approach to it.
I think Kelly covered what I was going to cover about the link between the multilateral and the bilateral, but also just a little bit on the vaccine and manufacturing. I know, we're also working with with regional bodies and countries to work on those kind of, it's not just access, but making sure they're not just recipients of research of the future, but also leading research on those efforts in these countries that we're working in. But also, I mean, it's been an issue before COVID, looking at diagnostics and therapeutics as well, and local manufacturing, rather than just reliant on sort of the Western world.
Sure. Well, I know, 2020 and 2021 has been kind of the years of the vaccine, right? I just turned 50, so I'm lining up for my shots all the time. But I guess my question is, if you could pick five diseases that you would love to have a vaccine for that you don't today, or maybe 3 or the top 2, which ones would you love to have a vaccine for next?
I'll name one. I mean, it's hard to say. I'll name one because I worked on tuberculosis. So
okay,
I would say that is a leader for myself. It's also a leading infectious disease. So
and drug resistant, right? I mean, those
drug resistant as well,
strains are getting very, very scary.
Yes, very much. So I think that would be my top one if I were to name one.
Yeah, I was just going to say the same thing. I mean, I think we stick with the things that we work on. So, there was recently a new vaccine for malaria that we're really excited about, but also recognize that we could get an even more effective vaccine for malaria. And then obviously TB, HIV, we do work to create an international AIDS vaccine. I think that would be critical. So yes, for 5. There's also, I think, on the childhood immunization side, there are vaccines that are relatively new, like for rotavirus, which is a diarrheal disease, and pneumococcal pneumonia in children that really need more uptake. So I think, it's both new vaccines, but really just getting at the existing vaccines.
That's great. I mean, I remember the old anti-malaria drugs they used to give us in the early 90s. And, yeah, it would be nice I'm sure we've moved beyond that, but very important. I guess one question I have is just in relation to the presentation. And, the HIV initiative has been so successful, right? So what do you think made that initiative, and it's really been a sustained initiative, what makes that so successful?
I'm sure Janet and others would have some thoughts. From the State Department side, the emphasis on data and learning really has differentiated the PEPFAR program. So they've really set a standard for collecting data at the embassies, and also coordinating at the embassies in our USAID, what we call missions, which are USAID in the field, coordinating across the different players. So in addition to our 2 organizations, which is state and USAID, there's other players. There's the CDC, HHS, and other US government players that come and fly in and out of these embassies all the time. And so PEPFAR has done a good job with AIDS and kind of coordinating across all the different players, and then evidence and data. But over to you guys, what do you think?
I know Kelly has her thoughts. I mean, everything that you said, Dafna, but I mean, we can't deny that there's a lot of money, and money helps. And if you compare the resources for PEPFAR for the, in our countries compared to, our MCH or malaria or TB resources, it's a huge thing. And there are other players as well. Global Fund, it's huge resources in HIV. Big advocacy community too has made sure that those resources are there. So yes, I think a lot of focus on the data, but the resources have definitely helped as well.
And I think just also from a previous Hill side experience, I mean, there's just such strong bipartisan support for PEPFAR, and global health on Capitol Hill isn't always an issue that I think until COVID maybe got as much attention as maybe we would hope. I think until COVID, talking about global health security as really a national security issue didn't always rise to the level that, in my personal opinion, it should have. But in terms of PEPFAR, I mean, if you ask most members who care about foreign policy, that they knew right away what that was. And so I think unlike some other global health initiatives, PEPFAR just has that name recognition, that bipartisan support, and that of course helps in terms of deciding each year the annual appropriations. That has a great impact in that.
You know, we're lucky in the Dallas area to have the Bush Institute. So, you know, George W. Bush was definitely a big supporter of efforts to tackle HIV in Africa and other areas. So we definitely see some of that here locally in town, a really good legacy for, you know, our local president, I guess we'll say. You know, I guess one question is, global health is definitely being linked not only as a security issue, and you mentioned that, but also linked to climate change. So maybe if you could address both global health security, both just as a general security issue, and also how is it going to be linked either now or in the future for global climate change?
I'm so glad you asked that, because many of our leaders at the State Department and USAID are really enthusiastic about this linkage and addressing this linkage. So the most obvious linkage is the deforestation problem. So the fact that in many parts of the world, forests are disappearing and wildlife is encroaching closer to very inhabited areas. We saw that in Wuhan. Regardless of the origins of COVID, it's absolutely clear that, you know, a city of 20 million people surrounded by forests, and there is a lot of wildlife there. So the same thing also in Africa, for example, in Ebola, it was clear that when a boy got bit by a bat, right, the connectivity between wildlife and human population is exponentially increasing the likelihood of these type of epidemiological problems. So there's a lot of energy here to connect the efforts to protect conservation land and forests to a public health outcome. And so we have some foreign assistance programs on the climate side that, you know, these colleagues at USAID do not manage, but are on the climate side to protect wildlife on land, I should say, not in the oceans, for this purpose. And it's at COP. At COP, actually, just this past 2 weeks, the United States announced some of these initiatives, and I'm happy to send you some of the fact sheets that Administrator Power and the Secretary and the President announced that reflect this linkage. USAID, I don't know if there's anything else.
Yeah, a couple of additional points. I think absolutely the potential for spillover of infectious diseases is a main climate concern, as is different climate patterns changing the pattern of diseases for things like malaria that are you know, dependent on a mosquito vector, changing where mosquitoes go. We saw this, I think, in the US when Zika was a problem in Latin America and some of those vector-borne diseases. I think also the increase in natural disasters related to climate change, which certainly disrupts health systems, disrupts the ability of people to get health care, you know, when there's earthquakes and hurricanes and other natural disasters. And so, you know, I think those are the impacts of climate on health, but then what are we doing about it? I think one is understanding and trying to plan and prepare for those impacts, but also thinking through, you know, are there ways to make health facilities more climate resilient, or to use clean energy and other kinds of things like that, which I think similarly to cell phones might be advantageous to the development of some countries, you know, where if you don't have to run wired lines out to facilities to get electrification and those kinds of things. So there's, I think, a full gamut of things that we are doing on both sort of addressing the impact of climate change, but also mitigating it further and thinking through how we can build it into global health programs.
You know, that's interesting. You know, when we look at the success of the HIV program and this line, I mean, is it harder? How much harder is it to build bipartisan support for these initiatives today compared to, say, I don't know, 10, 15 years ago? Or you don't have to answer that one. That might be too spicy.
No, I'll be honest, I'm a former health staffer, and I think my colleague Liz is too. I don't know about Kelly or Janet or others, but at least two of us on the screen from the executive side of the the US government have also worked on the legislative side. And so I was there when PEPFAR was authorized under the President Bush administration nearly 20 years ago. It was actually like 18 or 19 years ago. And I think there's been, some ups and downs, but really consistent bipartisan commitment to these issues. Now, the one thing I would say is some members have a particular interest in a certain disease, right? So there's some members who are really interested in AIDS. There's some members who are really interested, members of Congress, I should say, who are really interested in malaria, some who are interested in tuberculosis. So, but that doesn't cut across party lines. That's just individual interest. So for example, when members of Congress go on trips around the world, they might be shown a certain health clinic that's addressing a certain illness or disease or health issue, and then they become a real advocate for it when they return. But I would assess that the bipartisanship remains in an otherwise non-bipartisan environment. Over to others to comment.
Yeah, no, I would echo everything Dafna said. I mean, in terms of, I think the point that she made is really interesting, and something I bring up too frequently is, there is pretty broad, bipartisan support, but there are these members and usually, very influential members who have kind of pet areas in the global health space that they very much care about. And that's very important and it carries a lot of weight. But at the same time, when it comes to conversations regarding flexibility and regarding the amount of funding that is kind of pre-decided and not flexible to change and move based on needs as the world changes, that can make changing how our appropriations bills are structured more difficult. If you are the champion for tuberculosis funding, you're not going to be supportive of a change to tuberculosis funding if we need to move money around. And so there are some complications as a result of that. In the COVID space specifically, I mean, obviously, we have seen the partisan divides on this issues domestically, but I think what's really refreshing is from an international standpoint, both from all the 4 committees that we really deal with, Senate and House Foreign Affairs committees and the appropriations committees that focus on our international funds, there is broad bipartisan support for vaccines. Some of the Republican leads on those committees are some of the strongest voices for these things, along with their Democratic colleagues. So at least in the COVID space, we haven't really seen a partisan breakdown like we've seen domestically.
That's great. I mean, I think all of us want to get back to travel, back to trade functioning without all these bottlenecks and other obstacles. It's been quite a year or two, that's for sure. Well, what do you think American citizens can do? What role can they play in affecting global health security?
That's a big question. Well, I mean, I don't want to preach, but I think the President of the United States has made it quite clear that vaccinating our children and vaccinating our elderly and vaccinating ourselves is very important. So I will just echo what the President and Vice President have said again and repeatedly to really protect our country from this pandemic. And, be active citizens, right? One of the reasons we wanted to speak to various universities and citizens across the country is really talk about this work that we're doing in the US government and really make the point that, these types of diseases know no borders. They do not respect international lines of sovereignty. And I remember some of us were working in the US government during the Ebola scare, and it was really, really scary because we all thought Ebola was coming to Dulles Airport or to Chicago O'Hare any second.
It was here. We had it in Dallas.
It was here. Oh, in Dallas. Okay.
Yep.
So maybe you felt the fear too in Dallas. Just, I don't know if you remember, but it really felt like it was going to be super scary back then. So, these are emergency situations and we're trying to prevent them, but, and we want, folks all around the United States to know, how their taxpayer dollars and their members of Congress and their elected president and administration are working on these issues, but essentially also that this is part of our foreign policy, essentially to ensure that the U.S. is a leader in organizing the international community multilaterally to do this, because we cannot do any of this work alone. And we need countries from all over the world, not just wealthy countries, not just European countries, to step up and be leaders in their own neighborhoods. And that's something really critical to our foreign policy. And that, our secretary and administrator really talk about that a lot, about having, regional centers. So I'll give you an example. One thing that was started under the Trump and Pompeo administration that this administration has really continued and really put a lot of effort into is this African CDC idea. So the idea here is that our CDC, our Center for Disease Control in Atlanta, one of America's best institutions on public health, would partner with the African Union, which is the regional organization in Africa, to work on combating disease in Africa as a whole. And really, it's going to take a while to get the African CDC to the level of our CDC, but the idea is there's no reason that various subregions of the world can't create a global good for their own people. So those type of ideas are really important. Over to you, Kelly or Janet or Liz.
I would just say, again, kind of once a Hill staffer, always a Hill staffer. But I think in terms of, the Hill experience, just being an engaged citizen, congressional offices get thousands upon thousands of letters and calls and visits every single day. And a very small portion of those are about foreign policy, and an even small part of those are about global health. And so in terms of just engaging, if this is an issue you're passionate about, there's lots of ways to engage, both at the local level, but also federal level. And I know as a Hill staffer, I would frequently meet with student groups from colleges, whether it be like a local UNICEF college-based organization, or a group of students who had just gotten engaged and formed a club themselves. So from just even the student perspective, there are so many ways. And then just, I think also, talking to your family and kind of raising this issue. I think frequently, we forget just to educate those around us. And sometimes this doesn't rise to what folks are seeing on the news as often as, perhaps, we would like to see. So just using that, personal engagement opportunity too. I don't know, Kelly and Janet, if you have any other recommendations.
I don't think I have anything else. I think you guys covered a lot of it. Kelly, did you have anything?
All right, well, I've got a great question from one of our faculty members who teaches public health, and we're hopefully starting a new public health bachelor's degree here, and we have a public health minor. And so she wants to know, what are some of your favorite resources for teaching or sharing information about global health?
Well, I think Kelly will have to correct me if I'm wrong, that the Global Health Bureau still supports a global health e-learning platform. Am I right, Kelly? Just nod. That is free to anyone. It's more of a technical resource. You can, there's quite a few modules on different subjects, from detailed things on family planning to more general human resources for health. So that's one I can share the link, happy to share the link, but also there's a number of sort of networks that send out, there's a health system strengthening network and other networks that send out information about upcoming webinars and sort of new technical resources on that. There's quite a few. Thank you, Kelly, the e-learning. I don't know if Kelly, if you have anything else.
Just websites. WHO has a lot of information on specific topics on their website. It might be, there's links to documents. You can go sort of as high level or as in depth as you want. I think the same with UNICEF. USAID's website has a lot of information, as does PMI and PEPFAR and the other organizations.
Awesome, thank you. And, along those lines, we do have, I guess, any other resources for, say, researchers. And we have a question from Jesse DeFusco here that I'm going to address here shortly. But, we have a lot of faculty who are doing global health research. Any additional resources on data? For example, data is always a great thing to find when you're an academic.
I mean, there's lots of sources for data. I think the World Bank, WHO tend to aggregate a lot of sources. A lot of those are country sources that sort of stem back to DHS data and demographic and health surveys, which is a survey done in lots of different countries on a key set of health indicators that USAID does. The Institute for Health Metrics and Evaluation, IHME, out of the University of Washington, tries to aggregate data. So one of the issues is there's oftentimes missing data. So if you're trying to get at trends, there's data missing in individual countries on individual indicators or across different time periods. And so they do a lot of sophisticated analysis to estimate those holes in the data to provide a more robust picture. So their data is not necessarily a true number, but what is, it's estimates, but I think they do a lot of good job to get a more complete set than other sources of actually reported data.
That's fantastic. Thank you. And yeah, I mean, there's a lot of missing data, just missing number on infections. I mean, we're thinking about COVID, right? How many people were asymptomatic? I mean, I know we have a number of people in some of the studies just to track how many people have unsymptomatic infections and asymptomatic infections and still have antibodies. Anyway, good items. Here's our question from Dr. DeFusco. So she had been an Ebola responser and had worked with USAID in Liberia. And she's just wondering what are the lessons learned with policy approaches that were supportive but maybe too westernized? So are there any kind of general lessons learned on adapting policy processes to specific contexts or any other culturally specific issues of implementation or even policy design that we need to look at?
So interestingly enough, we literally just had a webinar on this morning with between USAID and the World Bank on lessons learned from Ebola. So I can, since I listened to it, I can tell you what the other people said, but which I agree with. And I think, some of it is just the importance of involving communities, which I think was highlighted as a lesson that we learn over and over again, not letting the perfect be the enemy of the good in terms of, especially during a crisis, sort of what's enough information to make decisions on and what do we refine from there and how do we move. I think one of the issues that came up was every time there's one of these crises, there's, we sort of figure out that everybody needs to coordinate together, and we feel like we have to relearn the coordination mechanisms, and sort of how do we build that for the long term. I think, in general, USAID is trying to work towards more localization of our efforts and really listening to country voices. In general for development, I think when there's a crisis, everybody wants to help and everybody wants to move really quickly. And so that's where, sometimes we forget the lessons that we've learned in the past and try to do them again. But I think all in all, we do a fairly good approach and we're getting better on some of these as we go. I don't know if Janet or Dafna have anything to add.
Not really, just to add out, I mean, like Kelly said, I think even outside, I know Ebola, there are a lot of lessons learned from that, but, like she said, we were trying more and more to do, we've always worked on local capacity, but I think involving more and more local organizations, doing more co-creation type of things for activities. I also think, if you look at PEPFAR, I think it's this year or next year, I think 75% of their funding has to go to local organizations. So as Kelly said, we do try to learn from these things and more and more of that sort of work locally and more listening, I think.
That's great. I know we're all trying to hone our crisis management skills because they seem to be coming rapidly with at all the time from new directions. So wonderful. Well, we are almost out of time. I'm going to plug our Peace Corps prep program here at UT Dallas. Jesse DeFusco is the new faculty member heading that up. But any other last minute pieces of advice for people who are interested in these issues? Anything else you'd like to leave them with?
I would just add that just last week, after a year and a half, USAID and state merged our websites. We were giving out numbers every year annually per country, per issue of what our foreign assistance looks like. So it won't give you the epidemiological data on diseases that you need. It's not at that level of specificity, but it gives the USG side of it, right? So what the US is investing in various parts of our foreign assistance. So the website is called foreignassistance.gov. Give us some feedback on it because we spent a long time honing it, so it'd be useful to academics in particular who want to do use it for research. But it is a good source if you're trying to look through trends over time, for example, across various countries and across various issues. So I would point you to that. And then I just wanted to thank Kelly and Janet and Liz before she left for joining, because here in F, we're just, we're seeing all of the budget come across our office, but we really don't have the expertise in any particular sector. And we have such talent at USAID and at PEPFAR here at state on global health. And we're really just proud of what the US government has achieved. So thank you for the chance to talk a little bit about what we do, and please come visit us when the time and situation allows in Washington, D.C.
Well, even better, as soon as I get back into the field, I look forward to getting back to my friends at USAID in Peru and in Colombia. They're always my first contact before I go into the field to see who else I should talk to or what other questions I should be asking. I've always found them to be an incredible asset to me in my research anyway. So thank you all for your commitment to global development and global health. And thank you for reaching out and having this event today.